My name is Alencia Johnson. I am the Director of Constituency Communications at Planned Parenthood Federation of America. And I work on national communication campaigns to engage young people, men, people of color, the LGBTQ community, and the faith community. And so I'm really excited to have this conversation with my panelists, and I want to introduce each of them. We have Elman, who is a journalist from Uganda and the White Ribbon Alliance. Elman, could you tell us a little bit about some of the work that you do?
Thank you. I'm very happy to be here. My name is Elman Nsinda from Uganda, White Ribbon Alliance Uganda. I'm a journalist and an advocate for maternal health. First of all, I would like to share with you my experience. I'm a father of 2 boys, and I'm on record that I accompanied my wife to the health facility during the antenatal period for 6 times. Yes, 6 times. Yes, you should actually clap because this is rare in Uganda, even in other countries like in Africa. When you accompany your wife there, they think you don't have what to do. You are wasting time. But this is my experience. I reached there and I saw how women suffer, how women are treated during that process. But it helped me so much to even enhance my relationship with a woman. And we got a lot of attention. We got a lot of support from the health workers. So I really encourage men to accompany their wives during that process. Why should a woman die when the husband is there? That is a big question that all of us should really answer. One, they all participate in the process. They participate in that moment of joy that brings life. Why should one die and the other one remains? So we are saying men have a lot of roles to play. One, from the day of taking decision, when to have a child, and how are we going to take care of this child. One, they should take care of the wife by ensuring that this woman gets the nutrition that is needed. 2, they should prepare for the transport to take this lady to the hospital during the time of giving birth. They should also engage the health workers to ensure that the women get the right care, the dignity, the equity and equality during this process, even after giving birth. That should happen. 2, the White Ribbon Alliance has been doing a lot of stuff in Uganda to ensure that women enjoy that process. They don't really die through that process. And we have really achieved a lot from there. We have seen men getting on board and appreciating the process that their women go through. But they have been telling us that before they didn't know what to do. Actually, they have been judging themselves that, no, if I knew, I would have helped the neighbor who died during childbirth. There is a story that I should share with you. There is a man who lost a wife through the giving birth. This lady went to the health facility. It is actually a hospital. And when she reached there, because this is a government hospital, it is supposed to be free, the health workers asked for 50,000 so that they can start helping this mother. 50,000 Uganda shillings is less than $20. So the husband did not pay because he thought, or rather he said he didn't have money. But mind you, this husband had an animal at home. He had a pig. He was rearing those pigs for income. He failed to pay that money, and the health workers did not take care of the wife, and the wife eventually died. Now, after the wife dying, the husband lamented, I wish I knew I should have sold my pig to save the life of my wife. So, because this husband didn't really care, or he was not knowing what to do during that process, he lost the life of his wife. So we are saying that it is the role of all of us to inform the world that men have got a lot of things to do to ensure that women don't die during that process. Even the babies themselves. Recently, we've been doing a project on streamlining the procurement process for newborn resuscitation devices. And people have appreciated that no baby should die in that process, because these are the people who are going to matter in the future, people who are going to be presidents and playing other roles.
Right. Thank you. Thank you, Elman. And Jenifer, can you give us a little bit of overview of some of the work that you do at Engender Health here in the States?
Sure. So I'm here to represent Engender Health, and Engender Health is a global women's health organization, so we're working in 20 plus countries around the world, working to provide opportunities for women to have some autonomy over decision making around when and how many children they have. And so in the United States, which is where my efforts are focusing, we're looking at how we can create that opportunity starting from a very young age. So we're working with youth, adolescents and youth, and primarily in the areas of pregnancy prevention and increasing education and access for young people to have contraceptive choices. And so in line with this conversation today, one of the things that we're really trying to focus on is how to involve men and boys in the conversation and in the educational process for family planning. And so we're designing and implementing sort of alternative or new ways of educating youth through gender synchronized approaches. So we're trying to bring both boys and girls together to learn about not only biology and contraception, because the conversation needs to go much further than that, but we're talking a lot about relationships and consent and control issues, and trying to reduce some of the violence that's occurring more and more commonly in young relationships today. So our programs are primarily curriculum-based, but they're also community-based. So we engage young people in the communities to talk to their peers and sort of experience their learning in social situations. So one of the programs that we've developed is called Gender Matters, and this program is considered a gender transformative, gender synchronized approach, which is a lot of jargony words. So really what that means is that we're just bringing men and boys and girls together, and young people of all genders together to learn about their sexual health, to have conversations about their relationships, and learn to communicate together, so that young men specifically can learn about this concept around consent and how to ask for consent within their relationships, and that we can learn about how to negotiate condom use so that we can increase contraception. Just recently, one of the things we've learned is that 30 to 38% of young girls end up dropping out of school, and they say that that's due to pregnancy and parenting issues. And so, if we can but sexual activity hasn't changed. So our goal is to really get young people to be able to negotiate and to control their contraceptive choices so that they can stay in school and really sort of cap the cycle of educational attainment and economic attainment for youth. So that's just sort of to get us started, and then I can share some more specific examples.
Great. So Elman, I want to ask you, what are some of the things that you all are doing in Uganda and in your region to do exactly what you just said, have more men involved? And it sounds like there's a bit of stigma and shame if men show up with their partners to the hospital for whatever cultural reasons.
Right now, we're having a project running and it is called Act Now to End Teenage Pregnancy. And in this campaign, we have managed to mobilize young people, about 120,000 young people petitioned the Prime Minister to coordinate the relevant ministries, Ministry of Gender, Ministry of Health, Ministry of Education and Finance, to come together, sit and agree on what to do, come up with a multi-sector plan to tackle teenage pregnancy. So that is a campaign running, but most of them, if you realize, they are men. So they are helping to champion the campaign. We have also engaged Parliament. In a few weeks, one of the MPs will table a motion on establishing a girl-child forum, parliamentary girl-child forum, where the issues of young people, especially the girls, are going to be discussed. So you can see there is a lot of activities running, but the most important thing is the young people have engaged the public through social media. There is a lot of stuff, and when we went to the Prime Minister to discuss on how we can coordinate the rest of the ministries, he told us that I know about this campaign. There's a lot of stuff running on the social media. But the work on the social media is done by young people themselves, and most of them they are males. So you can see things are running.
That's great, and that leads me to you, Jenifer, on young men. And here domestically, the president has been touting out that teen pregnancy rates are at an all-time low. What are some of the trends that you're seeing in engaging young people? Much like Elman said, I'm sure there's social media campaigns, but what's kind of the response in some of the work that you're doing from young men?
Great. So, and it's true that the teen pregnancy rates have been declining quite extensively, and that has been primarily due to increased access to contraception. Sexual activity remains sort of the same, and yet contraceptive use is increasing, and therefore we're seeing these dramatic declines in pregnancy. However, also of 20 countries that were examined to find these stats, the United States still remains one of the highest in pregnancies, in teen pregnancies. So we still have a lot of work to do. And so, one of the things that we've really started to look at and see as one of the most important aspects is in how we engage youth. And I think there's a lot of threads across the work that we do in terms of involving young people and putting them front and center in creating these programs and activities and initiatives, these social media campaigns and these programs that work for them, and starting to take a step back and ask them what works for you. And so we've been really trying to take a human-centered design approach where we really start to understand what the issues that young people are facing, and not just broadly, but narrowed down to the community level. And a lot of times we see programming that's specifically focused towards an ethnic group or a country or a large area, but we fail to look at the intersectionality amongst many of these groups as well. And so we've started to really try to test our programs with the specific youth who we're trying to target to understand their unique needs and hear from them what it is that works for them, and then start to ideate and plan for projects. And so one of the projects that we're currently testing through a randomized control trial design is a program that works with young parents. And one of the things that we heard from the youth that we've talked to is that we want to hear from people like us. We want to hear from our peers, and we want to hear from people who actually have been through this experience and know what they're talking about. And so we've designed a project with young people where we're going, the young parents are educated and trained around sexual and reproductive reproductive health education, in classroom management and how to be a facilitator. And we've trained them to become sort of certified health educators, and they're going into their communities and into the schools where they go, where they either attend or is part of their community, and they're talking to their peers about what life is like becoming a young parent and what are the realities involved. And so they're able to sort of make a substantial change in their communities based on their own experiences and allowing them to give back to the communities that supported them. So that's been really fantastic. And then on the other side of that, we also understand that there's a lot of stigma that gets placed on young parents in the community. And, I think I threw this out earlier, but, 30 to 38% of young girls are dropping out of school. And, that experience for them can be a very daunting experience. And so we're trying to help young people who are parents elevate themselves as leaders within their communities, and then we're working with them to provide, very pro-social, positive relationships with adults who believe in them and who can help them to achieve their goals. And while we're doing that, we're able to, give them professional development skills, connect them with employers in the community. So we're trying to bring in cross-sector, issue areas so that they can, get the job skills they need, get the job training they need to become productive citizens in the community. And so, I'm just using young parents. The question really is about how are you doing that with young men? Well, working with young fathers has been one of the hardest communities to tap into. And there's a lot of reasons behind that. Often when you're working with a teenage mother, the father is generally a little bit older. They have less access to services. There are less services designed for young men, particularly young parenting men. So they're really hard to access and tap into within the community. And so we've been having to do a lot of outreach and a lot of collaboration, again, across sector to engage young men into the conversation. And when we do that, it allows for these young parents as well to build more stable homes inside their own relationship, because they start to work together as parents and increase their parenting skills and their relationship skills.
And so when we talk about family planning, I know we run into this oftentimes at Planned Parenthood. We talk about family planning and reproductive health care, and people think that equates to women's health and it shuts people down. What are some of the ways that you all overcome that barrier of the belief that this is only a woman's problem? I know you all are engaging young men now, but what are still some of the other ways in which you're trying to just overcome that hurdle that it's more than a woman's issue, it's actually everyone's issue?
The White Ribbon Alliance is trying to reach all men in the country and women, trying to sensitize them about the roles of each individual in this process. We've tried to secure a number of opportunities from media houses. We take their young people, we take their men to speak on these issues. And we've seen very positive responses. The only problem is that people are not aware about their roles. But we've seen positive change. Men are starting to take care of their women, starting to accompany their women during the pregnancy for antenatal care. We've seen them engaging the health workers, especially those who try to be rude on the women. And we've also witnessed men going to court to petition over mismanagement of their women. Yes.
Jenifer, did you have anything?
Yes. So one thing I would add that we've been doing, well, I'll give two brief examples. So one of them is that we're talking about gender throughout all of the work that we do. And we're really trying to help young people kind of see where gender influences come from, how they're shaped by society, where it comes through the media. And helping them to start to recognize these gender norms within their daily lives and how they their behaviors specifically relate to gender. Some of the things that we know about traditional gender norms is that they have a huge impact on sexual decision making for young people. There's a lot of research that's demonstrated that if a young person has a very traditional trajectory towards their behaviors around gender roles, they're going to be a lot less likely to have a teen pregnancy or cause a teen pregnancy, a lot higher rates of violence and sexual violence within their relationships. And so we're trying to really focus on how we can help young people recognize and acknowledge these gender norms and then redefine who they want to be as a man or a woman. And so that's been one of the biggest approaches that we've used in allowing young people to see, and specifically young men to see, what their role is in sexual decision making. And so another thing that we've been doing is working within clinics. And one of the things that we know about gender norms is that young men are much more likely to access health services. And we've talked to several young men that have told us, you cannot go to a health clinic. You would be like, walking in with your tail between your legs is the way that they describe it. They use terms like man up and whatever. So we know that there's a fear and a stigma against young men accessing health services, and so we've been working with the clinics to do more outreach targeted towards young men to sort of decrease some of that stigma. And we've been talking with them about how can you create an atmosphere that's actually inviting for young men. And so we've heard like things that the advertising in magazines and clinics are all geared towards women, so it makes it feel like it's a women's place. And so how can we put messaging within the clinics that is open to men and young men in particular to get them more able to walk into those places and not feel like they're in the wrong spot.
Yeah, that's something we work on too at Planned Parenthood, to be a bit more gender inclusive, especially as our male patient population continues to increase each year. Do we have any questions from the audience? No questions? Okay. So what is, and this is for both of you, in an ideal world, what would this look like, right? If we've got this right, this advocacy work that both of you are doing, how would this really impact the outcomes for families in regards to men involved in family planning?
One thing that we should understand is in the developing countries, especially Africa, men take major decisions. They decide on when to visit health facilities. They can even refuse their women to go to the health facilities and direct them to traditional birth attendants. They determine the number of children to be produced. So really, we need to target them than even a woman who doesn't take major decisions in a home. So because of their importance, because of their power that they have, we, at the country level, a lot has been doing to empower women, but still there is a lot of gap because men are still taking those critical decisions. So we still need to ensure that we target them, they know their role, and we hold them accountable towards ensuring that their women live a better living. Oh, yes.
That's great. Jenifer, what about you? What does this perfect world look like?
Well, I'm looking at the Sustainable Development Goals behind me, and I would say that we've really turned the needle on many of these goals. We've increased educational access, contraceptive access, reduced poverty overall for both men and women around the world. And our focus really comes out of some of these goals in terms of how to, put more opportunity out there. And so I would say that that's where we're focusing.
That's great. Well, I want to thank my panelists. If there are any more questions or no more questions. All right, thank you both for all of this great work and doing this hard work.